both programs had a need in their curriculum. So this is a way for us to ensure that they're getting some of that preparation where they're working as an interprofessional team, collaborating and learning the best practices for how to optimize that teamwork before they have to do it in the real world with real teammates and real patients. The things that we have designed in this curricular experience were co-designed between USF faculty and the St. Pete College faculty about what was needed in both programs. So what's the PTA's role and scope versus the PT, and how can you make sure that you're following your State Practice Act and that you're doing things that are legal?
What I love about what we're doing today is the whole interprofessional education we're having. It's basically simulating what it's like in the real world when we're having team meetings and trying to get the best overall experience for our patients.
Students get to work with the mannequins, and so the mannequins are weighted just like a normal person, and they have to interact with one another and delegate and help each other out with the transfers and doing an activity in the patient hospital bed with the patient. We're better when we work together. The patient's going to have a better outcome. So just communicating anything at all as they are doing that transfer or that activity with the patient is very important.
We've had a really strong relationship with St. Pete College, and so it's made a really great partnership to have a PTA program that we can collaborate with.
All the USF students were very friendly, and they approached us with a smile, and I think vice versa. Once we were able to get the communication going, we were on pretty much the same page.
In the field, and from my experience as well as a physical therapist, PTs and PTAs are going to work hand in hand together, especially in skilled nursing and in acute care, and as well as outpatient. So they're going to need to be able to feel comfortable communicating with one another and not be reluctant to go to the other person to ask a question or if there's a change in the status of the patient. So it's very important for them to have effective techniques for communication and understand both ways that it's okay to ask a question. I hope the students, both the PTA and the DPT students, learn that they can communicate with each other effectively and they can take something away as far as how to delegate or how to receive information from one another as they work together in the simulated case scenarios and the case studies and all of the interactive activities that we have planned for them today.